In this video, you will learn how to score the PHQ-9 assessment and how to enter the assessment results into Practice Fusion. Remember that the PHQ-9 assessment should only be performed with patients age 12 and up. Go through questions 1 to 9 with the patient, circling the respective answers. Once you have all of the answers, you can go ahead and total the score. Here we have our patient responses. At some point, it's important that you write the PRN at the top right corner of the assessment sheet. Now we're just going to go through our patient responses and total the columns. As you can see, 0 plus all these zeros is going to equal 0, so that'll be the total for the first column. In our second column, we have 4 ones, so we're going to total that to 4. And then no 2s or 3s were circled, so we can just put 0 for that. And so our patient's total score is a 4. It's important to make sure that if your patient selects any number other than 0, that you follow up with this question below that states, if you checked off any problems, how difficult have these problems made it for you to do your work, take care of things at home, or get along with other people? And the options are not difficult at all, somewhat difficult, very difficult, or extremely difficult. And as you can see, our patient selected somewhat difficult. You will use this sheet to help you interpret the score from the assessment. But down here, you will see the PHQ-9 scores, and aligning with that is the depression severity of the patient. If a patient scores 0 to 4, their depression severity is either none or minimal. If a patient scores 5 to 9, their depression severity is mild. If a patient scores 10 to 14, their depression severity is moderate. If they score 15 to 19, their depression is moderately severe. And if they score 20 to 27, their depression is severe. And since our patient scored a 4, their depression severity is none or very, very minimal. Now that we have the patient's assessment score, we are going to enter it into Practice Fusion. So we're going to go ahead and open the encounter note and scroll down to the SOAP note section. So we'll pass up subjective, objective, and once you get to assessment, you're going to go ahead and look for the section that says Screening, Interventions, Assessments. And as you can see, we have already entered the GAD-7 assessment. So now we're going to go ahead and enter the PHQ-9 assessment. So select Add, and we're going to search for the assessment just by typing in PHQ-9. And here it is, depression screening using PHQ-9. So we're going to go ahead and select this one. From here, you're going to change the status from ordered to performed. You're not going to be selecting any results because it doesn't allow you to, so don't worry about this piece. But enter the result into the comments. So since our patient scored a 4, we're going to go ahead and enter that and the meaning or the interpretation of the result. And now you're going to go ahead and hit save, and it should pop up right under SIAs again. So here are the assessments that you performed on the patient, and this is helpful for providers to refer to, for staff to refer to, and this is just helpful data for us to continue compiling. That way we can expand our services around mental health.